Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Amy Stewart, who is the Chief Nursing Officer at the American Association of Post-Acute Care Nursing, about CMS's new skilled nursing facility payment rule. So, hi, Amy, how are you?
I am great. Thanks, G. Thank you for having me.
Of course. Thank you for being here. And this is going to be a really interesting conversation today. As I'm sure you know, there's been so many different rules and policies and new pieces of legislation coming down the pipeline that affect nursing this year. So right at the top, I wanted to ask you, what would you say are sort of the greatest legal or policy-driven challenges in post-acute care nursing in 2026?
That's a loaded question, and I'm going to take probably a little bit different stance on this than most people. But I really feel like the challenge, the biggest challenge we're seeing right now is how we demonstrate that we have the staffing, the competencies, the systems in place, and documentation necessary to safely care for an increasingly complex population while reimbursement and regulatory expectations to continue to change and they are ever evolving.
hmm hmm Absolutely. Yeah. It seems like every week there's something new that's coming out of that. So, absolutely. So, can you explain to our listeners what the CMS 2027 final rule is, or the final payment rule for skilled nursing facilities?
Sure. And, just to give a little background, every spring we get a proposed rule. The proposed rule comes out, and people are encouraged to submit their comments. AAPACN also submits comments every year, and then the final rule comes out the end of July, early August. And this year's payment rule was interesting. And everybody expects to hear about the increase in payment. And this year SNFs received 2.4% Medicare payment increase. And CMS finalized this increase in that, in the SNF PPS rates, reflecting a 3.3 market basket increase minus the 0.9% point productivity. And CMS estimates this will increase aggregate payments about 880 883 million in
Oh,
fiscal year
wow.
2027.
hmm
Now, it sounds like a lot. However, we also have deductions for like the SNF value-based payment and sequestration. So it isn't as great as it seems, especially when you match that with the growing acuity of residents.
hmm
I don't know if you want me to go over more of the items, but I'd be happy to, because I think that there's a huge piece here um, that most
Sure.
people. Okay, good.
Yeah,
Um,
absolutely.
yeah. Well, so here's the thing. There is in this final rule the SNF all-payer quality reporting program, which begins in the fiscal year 2031. So people are thinking, well, that's a long ways away. But
Mhm.
wait a minute. This means that MDS reporting is expanding beyond Medicare residents beginning October 1st of 2029. And this is one of the challenge I think nursing and MDS leaders should really pay close attention to. CMS finalized this requirement that SNFs submit MDS data for the SNF residents receiving covered skilled care regardless of payer, which would be new. Now, why does this matter? Well, it matters because we have an RAI manual that gives us instructions on how to accurately code the MDS for Medicare,
Mhm.
but we have different rules or additional requirements that come from Medicare Advantage payers and also from Medicaid payers. So it's going to be interesting. And I think this means that the MDS accuracy from now until October 1st, 2029, facilities really should start thinking about whether their MDS process, their nursing documentation, the diagnosis capture, and the interdisciplinary communication along with auditing systems are really prepared for this broader reporting population because it's going to be more work to track this.
Mhm. Absolutely. And also 2029 is not that far away.
You know what?
You
It
know.
isn't. It isn't. But people focus on that 2031 when you think about it. And it's,
Mhm.
I get that a lot. I'm like, well, anytime CMS gives us more time, that means that the change is going to be larger. And so we should take this time to really put processes in place.
Mhm. Absolutely. And I mean, it's still only 5 years, which, will be gone in the blink of an eye, it seems these
Right.
days. So,
Right.
absolutely. So, what does this rule mean for nursing home operations and other post-acute care nursing facilities?
There's so many things going on here. Like I said, the finalized SNF QRP, of course, that's going to be big. We at AAPACN, we have a lot of concerns about how this is going to impact Medicare Advantage plans on assessment accuracy, because what do you do if they're telling you to code one way and the REI manual tells you another? Now, we don't currently submit Medicare Advantage MDSs
Hmm.
to the CMS database, but now we would be, I would assume we're going to be. So I think, that's going to be a big change. So we're going to have more MDSs to submit, and really that accuracy piece is huge. And in addition, one thing that I want to kind of circle back to is the SNF QRP reporting is
Hmm.
shortening their window of 4.5 months to about 45 days for submission, for data submission. And so that gives you a lesser window, a smaller window to actually review your MDS for accuracy before you get in that SNF QRP, and then you're going to lose, some payment. So that is also something that really people should be focused on. Another, you know, change in this is right now operationalizing how you're going to track other skilled admissions, like how are you going to track all these people if they're skilled or not skilled, which will be something we'll need to do in the future. So again, even though and again, the all payer piece is the biggest piece, and you can't really wait until October 1, 2029. You really need to start preparing by assessing every facility's priority risk areas.
Hmm. Absolutely. And to kind of piggyback off of what you said at the beginning of our chat, how does this impact staffing, and also resident access to post-acute care?
So I think for the nurses on the floor, APACN did a survey with LTC 100 in November of 2025, and one of the challenges that nurses mentioned was all of the regulatory burden and the documentation. Well,
Hmm.
guess what? Now we're going to have probably more documentation
Yeah.
that we need to really, and when I say documentation, I don't mean checklists. I mean, really, depicting the resident in more of a narrative way to determine whether or not this person is receiving skilled care or not receiving skilled care. And then also ensuring that you have the documentation for payment, right? So that's
Hmm.
always been, an issue. As far as, for staffing, like staffing, one of the things that I find interesting is I think we're shifting in long-term care from a recruitment issue to a retention issue. And it's, you know, you, you have to think of ways and be creative about how you're going to retain your staff, because retaining staff usually leads to better outcomes for residents.
Hmm.
And for the nurse leaders that are listening, I would say, this challenge of isn't it, it's what we're facing today, it's not just about filling shifts, it's demonstrating that staffing is sufficient for your actual acuity and the needs of your resident population through the facility assessment and related documentation. And there's no great tool that gives us that information.
Hmm.
um, and from a resident standpoint, like access standpoint, still a little bit concerned about the Medicare Advantage prior authorization process. Although CMS has put some rules in and has gotten better, there is still a lot of confusion about whether or not a resident is able to go home and care for themselves or should still stay in the facility. So a lot of Medicare Advantage plans will say it's time for this person to go home, whereas the staff of the facility are saying, it's we think they should stay longer and get stronger. And I
Hmm.
think that that is kind of an access issue um, for the residents. I mean, it's not up to us to decide, whereas on traditional Medicare, you do get that ability to have a interdisciplinary discussion about what skilled care looks like and how the resident might benefit from a day or two more of a stay, that kind of
Hmm.
thing.
Hmm. Absolutely, yeah. And to kind of touch back on what you were saying about the documentation, I think it's interesting. Do you think this will coincide well, or maybe not so well, with like the rise of like using ambient listening and AI for documentation? Like, do you think that will help with some of this?
Oh, I'm a big fan of ambient charting.
Hmm.
There's a lot of rules that go along with it though.
Hmm.
Because using AI still can make mistakes, but I think that that would be very helpful in collecting all the little things that go on when you assess a resident. Because
Hmm.
right now the process is, I might assess 5 residents and then go sit down and do my charting, and you can easily miss a piece here or there, right? Whereas if you have the ambient listening, the ambient charting, they're picking it up and you're reviewing the note and saying yes or no to, what is there. Now, a lot of homes, a lot of facilities are going to struggle to use this because you have, you know, more than one person in a room who could be listening. Is this a breach of HIPAA? Then there's also, you know, the issue of the resident agreeing to have this used. Like right now, if you go to the doctor, you may have had them say, "Is it okay if I use ambient charting to do our assessment today?"
Hmm.
And so we have to have processes in place. But I'm a strong believer that ambient charting would be very helpful in the future
Absolutely.
and today.
Absolutely. Yeah, so you brought up the SNF quality reporting program. I was reading it a little bit earlier before we got on call, and I saw that they were removing measures regarding COVID-19 vaccinations. And so I was
Mhm.
wondering, what do you think the impact of that will be on skilled nursing facilities?
Excellent question, because this is still going to be required through the end of this year, the calendar year. We still have to collect this data. So while I'm grateful that this has been removed because it's really confusing as to what up to date means. And we get a
Hmm.
lot of questions here at AAPACN related to that. But I think right now, listeners need to remember that you have to collect this data through the end of the year. So don't quite give up yet because it
Hmm.
still counts. So the data collection for the fiscal year 2028 actually occurs during calendar year 2026, which is what we're in now, meaning data collected during the current calendar year, um, like after this, it's fine, but right now you also have to report on it on the MDS until it's taken off of the MDS. So I think that's something that's important to remember.
Hmm. Absolutely. And then my last question for you is, what do you think are some of the broader implications for these rules, even beyond skilled nursing facilities, and how do you think they kind of cross-pollinate with health systems?
You know, Two things come to mind. First of all, if you take a look, and I've been in nursing for, I think this is my 29th year, and increasingly I have seen where we're moving towards a healthcare environment in which payment, quality, clinical data, and accountability are increasingly interconnected. And so, and that's across the board, and it is especially true in post-acute care settings, right?
Hmm.
Um, so I think that that's one of the things that people need to focus on. Like, quality outcomes matter, and they're going to
Hmm.
matter more in the future. The second thing is, we're seeing it, well, really, it's really the second thing I was going to say was the outcomes. We're shifting from just a payment for services based on an assessment to outcome data. So SNF value-based purchasing is an example of that. Um, and when you think about beyond skilled nursing facilities, we really all need to work together. So hospitals need to work with SNFs, SNFs need to work with home health so that the transfer of information regarding this resident or this patient is seamless. And
Mm-hmm.
that's going to be really important. So they, if we're receiving a patient from the hospital, we need all of the data we can that's required for us so we can have a comprehensive care plan so we can ensure that the outcomes are favorable for this resident. And the same holds true with when we transfer somebody to home health. Same kind of deal. They need that information.
Absolutely. Well, thank you so much, Amy, for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights. And I think this is a really valuable conversation. So thank you to our audience for listening. And thank you, Amy.
Thank you, G. It was great to meet you.
Thanks.